Well, in a moment, we'll be speaking to Dr. Rav Seeruthun from the drug manufacturers Roche about why this drug is so expensive. But first, I'm joined by Hayley Kalaninsky, who you saw there in the film. Hayley, tell me, what difference has being on this drug made to your life?
I have an extremely better quality of life. I've got good comparisons to make. I've been on chemotherapy now for over 3 years. I was diagnosed back in July 2011. So this is my 5th different type of chemotherapy, and I get very minimal side effects from it.
So what do you make of the decision by NICE not to approve it for other women?
What I would say is, how can they put a price on somebody's life? Cancer doesn't just affect older people. I'm only 33. I've got 4 young children at home and a husband. They need me. £90,000 is an extortionate amount of money. They need to bring the price down, and it needs to be available on the NHS. Young ladies like myself need to be on this drug. It's a miracle drug.
I mean, I suppose the point NICE would make is that every individual case like yours is so compelling, but they have to weigh up what is the best use of resources for a wider group of people, I suppose. Do you understand that? Do you accept that?
Yes, I do understand that. Obviously, I'm in this. I want the best drugs for all of the secondary breast cancer ladies out there, and obviously I will speak for all of those today. Nobody should have a price put on their life. How can they say that they have a limit of £30,000, £50,000 per year for one patient? Well, some patients in the UK don't need any treatment. So I'm interested to find out, is this for every person in the UK? They have a budget of £50,000, excuse me. Again, like I said, how can they put a price on somebody's life?
And what would you like to say? You've made your point about NICE and the NHS, but what would you like to say to the drugs manufacturer?
I think they've created a fantastic drug, which I'm very grateful to be on. Obviously, all the research been done, the hard work has been done here, and just to bring the price down and to make it available to those who really need it.
Hayley, thank you so much for joining us this evening. Dr. Seeruthun, really compelling case. She wants you to bring the price down. Why don't you?
Well, my background, actually, I'm a general practitioner, and I'd just like to say to Hayley, thank you for sharing her story. We're extremely disappointed by NICE's decision today to restrict this drug in the UK and not allow it via NHS prescribing. This is actually the 8th drug in the advanced breast cancer setting, though, that's not been approved since 2011. So it's not just a question about Kadycla, it's the 8th drug.
But you know that for NICE, for the NHS, this drug is simply too expensive. Now, as I said, Hayley's case is very, very compelling, and no one would not want her or other women like her to have the drug. But the point is, NICE have to make a wider decision, don't they? And your drug is too expensive.
Well, if it's the 8th drug that can't get through the advanced breast cancer setting, I would actually say that NICE's system isn't fit for purpose. It's broken because actually there's a separate system, because no drug can be approved in that advanced breast cancer setting since 2011. Hayley's very compelling story. She gets the drug via a separate system called the Cancer Drugs Fund that only continues till April 2016. So maybe, thinking about the patient today, what we need to is get to a point where we fix the system at NICE so we don't have to rely on this parallel system.
Yes, but the point is, you talk about putting the patient at the heart of all of this. No, you're a business, you're not a charity, I know that, but you made around 11 billion operating profit last year. You've paid out an increased dividend every year since 1986. I mean, if you're so concerned about the patients, presumably you could afford to bring the price of this drug down.
Hayley mentioned the innovative drug this is. We're talking about a drug called Kadycla. It's here. Now, actually, the amount of research and development this drug has taken, not just this drug, but all those other drugs that have failed. Actually, Roche puts in over $10 billion in 2013 into research and development. So actually, I think what we have to think about today is that a drug that has taken 30 years to develop, 15 years, and many patients.
This is not about just the costs of R&D, because in a letter to your shareholders last year, your chairman said, our focus on targeted medicines, of which this is one, is allowing us to significantly improve our net income. In brutal terms, this is a money spinner for you, and that's why you won't sell it more cheaply. So
this drug is actually approved in a number of other countries, a number of countries that have comparative GDPs and have comparative health systems: Sweden, Norway, Denmark. And actually, it's a difficult thing, because I'm from a background where I'm a general practitioner and I work for Roche, but what I'd like to say is, if we bring it back to the patient, we would have to drop the price by 60% to make this approved by NICE. What I'm struggling with slightly for patients like Hayley is why is it this drug can get approved in other countries, and yet
because it's not like with like. I mean, in other countries, for example, what we don't know is, in paying the price that you charge for this drug, we don't know what treatments they're not giving patients in that country.
Actually,
and I suppose the bottom line is, sorry to press this point, but you could afford to make it cheaper if you so wanted to. Now, you offered a discount, you said, that was significant to the Department of Health. What was that discount?
So actually, I think you should ask NICE that question, because NICE aren't here today, which I think is an interesting decision, because their system is broken.
Sorry, I'm asking you because they're not
here, And I will tell you the answer that NICE will give you, and the Department of Health as well, and that's actually a very difficult answer. NICE can't disclose that figure, and the Department of Health won't disclose that figure.
I understand there are no Department of Health regulations that prevent you from telling me now what that discount is and how significant it is.
I'm going to have to disagree with you on that point, because there are regulations in place that say you can't discuss it. But bringing it back to the patient, which is where I think we need to finish this with, looking at Hayley, is that why, if it's available in other countries, and does that mean that patients are 60% worth less because we can approve it in other countries?
I'm going to have to finish it there. I'm so sorry, but thank you very much for coming in, Dr. Seeruthun.
Thank you.
Kathy.
Thanks, Jackie.